Today we have with us Dr. Ankit Tomar from New Delhi, India. And for me, this is a little bit of a reunion because I had the pleasure of meeting Doctor at our headquarters here in New York while he was doing his fellowship with Dr. Finger. Dr. Tomar, how are you today?
I'm good. So nice to see you again, Henry. How have you been?
I've been fine. Your experience as a fellow was a little different than many others because the pandemic came and you had to stay longer than anticipated. Tell us about your fellowship and about the extended stay.
I'll never forget the time that I spent in New York with Dr. Paul Finger. He's an excellent doctor and an amazing mentor. I worked with him in his office in the OR and did a lot of research projects with him. His clinics have always been very busy with a good number of patients. So for a fellow, that's a very unique experience because then your learning curves becomes very steep. I was relatively inexperienced when I joined the fellowship, but with time, I saw different types of cases, and that all added to a sound knowledge fund, which I'm sure will help me in every aspect of my future practice. When it comes to the ORs, those were the days which I personally enjoyed the most because in the OR, I got to see Dr. Finger performing the most complicated forms of surgeries and a really diverse variety of surgeries. So these, which I had never seen before. So every single OR day was like an adventure, especially with Dr. Finger managing the OR, the staff. Whereas when it comes to research, it was something that I got more accustomed to during my fellowship, particularly with respect to manuscript writing and statistical analysis. I always had clinical questions which could be addressed by research, but the ability to conduct it effectively came with time and with Dr. Finger's guidance. We have worked on over more than 10 projects and published 5 papers in international ophthalmology journals. And for a fellow who hails from outside the United States, to get a chance to publish in major American ophthalmology journals, it's almost unheard of, especially so early in your career. So for this, I'm extremely grateful to Dr. Finger.
Wonderful. During your time in New York, did you experience anything that you hadn't expected when you signed up for the fellowship?
Honestly, it has been the best experience of my life. I've always been fascinated by New York City, and to get a chance to spend a year there was amazing. I mean, I don't have words to explain that. Whereas my time with Dr. Finger, I mean, I've learned so much from him. One specific thing which I really appreciated about Dr. Finger's practice was that science always goes hand in hand with clinical practice. He isn't afraid to think outside the box, and he has always encouraged me personally to be completely updated with the recent medical advances, and hence the attitude to provide the best medical care to our patients. So this is something which I feel I'll always carry with me in my life. Personally, I feel he has taught me more than just medicine and science. He always says work with perfection and with honesty, do your best work and your effort would be seen and you will learn. So this is something that I can never forget about him.
Tell me about the state of medicine in India, ophthalmology in particular, and how you're going to use the skills you learn to improve.
Ophthalmology is a very competitive field, I think, in the whole world. In India, we have the second largest population country-wise in the world, and we see a huge variety of cases. In terms of eye cancers, the specific eye cancer, which is retinoblastoma, India has the highest incidence of that. So when I come from a background like that, the experience that I gained with working with Dr. Finger becomes even more important because we have a very low or rather a skewed doctor to patient ratio. So not every patient gets a chance to be treated by a specialist. And with eye cancers, when your life is at stake, that is not something which is acceptable in this current time. So after having trained under Dr. Finger, I believe that I will be able to provide the best care to a large number of my country.
That's very good. Did you have a chance to put into practice already what you have learned, or is this something that you're planning on doing in the future?
That's a very interesting question. Because of this COVID crisis, we are in a very particular situation. India has had the strictest lockdown measures so far. So routine medical procedures and practices have slowed down. So most of the hospitals are not hiring currently. So my current plan is to continue working on the research projects that I have picked up with Dr. Finger and pursue my research aspirations. Once this situation is resolved, then I'll probably look in to start my own practice, which I'm planning to start in my hometown. Uh, Again, I have this unique experience that we don't have any eye cancer specialist in around 800 miles surrounding my area. So
Uh,
I feel I would be a good help to all the patients who have to travel more than 1,000 miles to even get a single consultation.
if you were to give some advice to a fellow who was just starting out, what would you say to them?
What I would say is that any person who's pursuing a fellowship with Dr. Finger, they should keep a checklist of what they want to learn every single day and what they should have learned by the end of their fellowship. Be organized with your goals for even every single day. Read, and more importantly, read as many papers as possible. Be updated. Uh, and remember to be thankful. Take every opportunity, make the best use of it. This can be an amazing and a formative time in your career. So make the best use of it.
Wonderful. Uh, we're very appreciative of your filming this with us. Would you have anything else that you'd like our audience to know?
I would like to just thank the New York Eye Cancer Center, the Eye Cancer Foundation, Dr. Finger, all his patients, staff, and the supporters. Because without all these people, the opportunity that is provided to us international medical students to work with Dr. Finger and to experience all what I have experienced wouldn't have been possible. So I really appreciate this chance that has been given to me, and just keep up the good work.
Thank you, Dr. Tomar. You hit the nail on the head. The Eye Cancer Foundation cannot provide this kind of service without the support of donors. So I appeal to all those who are watching this to be generous in supporting the Eye Cancer Foundation. Thank you.